Welcome to the Irmo Smiles Parent's Guide to a Lifetime of Healthy Smiles. Here at Irmo Smiles, we've seen a lot of patients and we've heard a lot of stories. And we have a ton of adult patients who have lots of dental problems secondary to neglect. And when we dig into their history, often that neglect is secondary to a bad experience that they had at a dental office as a child. When we decided to add pediatric dentistry to Irmo Smiles, that scenario is exactly what we wanted to avoid. We wanted to create an environment that's warm and nurturing where a child could come and we could build a foundation of good dental experiences where the child enjoys their visit, there's not pain, we give the parents and the child the tools that they need to be successful, the oral hygiene instructions, the nutritional instructions, all the information that they need to be successful.
It's important to care for your child's oral health and teeth from birth. On rare occasions, sometimes babies are born with teeth. As long as there's no risk of swallowing them or any pain, you usually just have to wait for them to fall out on their own. Also, the importance of taking care of your baby. Make sure you don't send them to bed with the bottle, and definitely wash their gums out right after meals. The reason why we discourage nighttime free breastfeeding and sending your child to bed with a bottle is that studies have shown that this has been a major cause of cavities. Always clean your infant's gums with a warm, moist washcloth wrapped around your finger and gently massage around the gums top and bottom to help alleviate teething and also to wipe the bacteria off the gums. Teething can be a very stressful time for a parent and the child. Here are a few tips that will help you get through the teething process. First, using cold teething rings. Giving Tylenol or ibuprofen when the child is fussy, that can help alleviate some of the pain. It's important to remember that dental decay is an infectious disease. It's very important that you do not share utensils, or worse yet, clean the binky off by putting it in your mouth and then giving it back to the child. The next stage in your child's dental development is when they first start to get their teeth, usually around 6 to 8 months. Continue to wipe down their gums with the warm, wet washcloth, and also start brushing their teeth with just a tiny smear of fluoride toothpaste. The American Academy of Pediatric Dentistry recommends that your child be seen by a dentist by age 1. As a parent, continue to clean your child's teeth twice a day, brushing them with just a smear of toothpaste. Continue to look at your child's teeth. Look for any suspicious white spots or brown spots on there, which could be an indication of cavities. By 2.5, all the primary teeth should have already come into the mouth. At age 2, increase the size of the amount of toothpaste to a pea size as opposed to a small smear. By age 3, most toddlers should have stopped using a pacifier or sucking their fingers. Teach your child to spit out the toothpaste and show them how to brush their teeth using small circles. And also suggest using an electronic or sonic toothbrush to help clean between the teeth better. Generally, children will continue to need help brushing their teeth, as hand and eye coordination just aren't there yet. The American Academy of Pediatric Dentistry recommends that your child be seen by a dentist by age 1. At your child's first dental visit, we can answer your questions about how to brush their teeth, about their diet, and the amount of fluoride that they may need. This first visit will also get your child accustomed to coming to the dentist so that they would be more comfortable coming in the future. Our goal at Irmo Smiles is to provide a positive, happy experience for your child and want them to want to come back to the dentist. We feel so strongly about this first visit that cleanings and examinations for kids under 2 are free. From sugary foods, juices, candy, gummy vitamins, in addition to bacteria in the mouth, all cause cavities. Replacing the juice with water or non-sugary beverages can help your child become cavity-free. The American Academy of Pediatrics recommends no more than 4 to 6 ounces of juice per day. Sippy cup use and in-between meal snacking can expose your child's teeth to more sugars, which can cause cavities. To minimize these risks, have them brush their teeth more or rinse out with water after these sugary snacks. by 2.5, all the baby teeth should already come in. On average, at age 6, you may notice your child start to lose their baby teeth and start to get adult teeth, usually on the bottom there. Don't worry, when this happens, sometimes it may be necessary to help wiggle those teeth out. Every child is different. Some kids a little bit older might not have their adult teeth yet, or some children younger than 5 will start to lose their teeth early on. If you notice your child is uncomfortable having loose teeth in there, please let us know and we can evaluate that at the office. Pacifier, finger, and thumb habits are a normal part of childhood development, and these habits should diminish between the ages of 2 and 4. If these habits persist after 3 years of age, changes can occur to the teeth, to the lips, and to the jaws.
I'm often asked when a child should first see an orthodontist. The American Association of Orthodontists recommends that every child be seen by the age of 7. Now, what's important to know is that most children that age do not require treatment, but there are some that will benefit from interceptive treatment. Sometimes early braces, an appliance, maybe even just taking out a baby tooth to guide eruption can prevent big problems later on in life.
A benefit here at Irmo Smiles is that we have an in-house orthodontist that can meet your orthodontic needs so that you don't have to go to another office.
Now at Irmo Smiles, your first orthodontic consultation is complimentary. There's no charge. We do a full exam. We'll take a 3D x-ray so that we can image all of your child's teeth, and we'll explain, any complications that we see possibly arising in the future. We'll go over what you can expect and talk about whether or not treatment is needed at this time. The Insignia system has revolutionized the way we treat patients orthodontically at Irmo Smiles. The coolest thing about it, patients are happier. They're getting the results that they want faster than ever before. There's nothing like taking off a kid's braces after he's only been in treatment for a year and he's got a dazzling, incredible smile. It's a smile you just can't wipe off his face. For me professionally, the Insignia system has made my job just so much more satisfying. I feel like the results that I'm producing now are far better than what they were before. I'm able to treat children quicker. The technology is really just that amazing. There are many benefits to orthodontic treatment. First is oral hygiene. Straight teeth are just easier to keep clean. If your teeth are a jumbled mess, it's hard to get floss in there, it's hard to brush effectively. Second, a healthy bite is less susceptible to the damaging forces of clenching, grinding. We're less likely to see fractures and problems later on in life. Third, and to me most importantly, is confidence and self-esteem. Study after study shows that the first thing that people notice about you when they meet you is your smile. Well, if you're self-conscious about your teeth, if you don't smile, what does that say about you? It may say you're conceited, it may say that you're unfriendly. It may not be the case at all. It may just be that you don't like your teeth, or that your child doesn't like their teeth. So, a beautiful smile that you show off gives the impression of being friendly and confident, and I just feel like you can't put a price on that.